Hi, everyone. Welcome to our Wellness Wednesday webinar. We will get started in just a few minutes. Hi, everyone. Thanks so much for joining. We're going to get started in just a couple of minutes. Hi, everyone. Thank you for joining. We have about a minute or so, and we will kick off our October Wellness Wednesday webinar. All right, I think we'll give it just one more minute. Happy October, everyone. Don't know if you're like me, but I cannot believe how fast this year has flown by. We're quickly approaching holiday season and 2025. Very exciting. All right. Well, it is 12 o'clock on the dot. Want to be very respectful of everyone's time. Hello, my name is Katie Powell. I am a well-being consultant for Care First, and I'm really excited that you joined our Wellness Wednesday webinar presentation. We offer these webinars every single month, and they correlate with the health observance. So October is going to be about breast cancer. and we will be talking about how prevention is power. All right, before we actually get into any agenda or content, would love to ask you all this question. Have you ever known someone who has or currently has breast cancer? We're going to do several of these interactive polls throughout our presentation, so good way for you guys to engage. Right, give it another second or so. All right, it looks like the majority do have a close family member or a friend or just know someone who has had breast cancer. And we do also have some breast cancer survivors, thrivers, as I like to call them as well. So really wanted to start off with that poll because it really brings to light the importance of just how real breast cancer is and how it's everywhere. And we're going to see that in the statistics. So our agenda is going to be, next slide. Obviously, we'll talk about what breast cancer is. We'll talk about the different types of screenings, prevention and treatment, and then life after a breast cancer diagnosis. And then we always like to provide our Care First resources. Next slide. So many people are familiar with breast cancer. Wanted to know if you know, next slide, if breast cancer can only affect women. Is that a fact or is that a myth? Wow, so many of you are voting. Thank you guys for participating. Give it one more second. Awesome. Yeah, so it looks like a lot of you are saying it's a myth. Let's get to the next slide so we can find out. All right, so first let's talk about breast cancer. So breast cancer is the most common cancer for women in the United States, except for skin cancer. So it is extremely prevalent. It goes skin cancer and then breast cancer. It is the second leading cause of cancer death in women, just behind lung cancer. Looking at this picture, a breast is made up of three main parts. There's the lobules, which you can see, there's the ducts, and then we have connective tissues. So the purpose of the lobules, they are the glands that produce milk. The ducts are the tubes that carry milk into the nipple. And then that connective tissue is what surrounds and kind of holds everything together. And that consists of fibrous and fatty tissues. So when breast cancer occurs, that is when cells within the breast grow out of control. And there are several different types of breast cancer. It really depends on which cells in the breast turn into cancer. And in a few slides, we will get into that. But to answer everyone's question, it is a myth. So men can get breast cancer. It is less common. It is 1% of less of all cancer cases are men, but just as a reminder, men can get it as well. Next slide. All right. So I'm a big statistic person, and I think understanding kind of the data and the numbers is really helpful. That is a very large number. 310,720 women, this is an estimate, will be diagnosed with breast cancer in 2024. So the largest stadium in the United States is MetLife Stadium, and that holds 82,500 seats. This statistic is the equivalent of filling up that stadium almost 4 full times with new cancer diagnosis. So really kind of let that sink in, and that's just in 1 year. 30% of all new female diagnosis this year will be breast cancer. We are seeing that in the evidence and the data that the majority of breast cancer cases are for those that are 45. Now that's about 91%, but there's still 9% that can be much younger. And just kind of a note is that 14% of cancer treatment costs were attributed to breast cancer. So every year, about $29 to $30 billion. We're going to talk about the most common types of breast cancer next. So next slide. All right. So again, like I had said, breast cancer is determined by the specific cells in the breast that become cancer. There are different types. Intraductal carcinoma, also known as DCIS, is when it is found at stage 0. So the cancer cells are found within the milk ducts, but it has not spread outside. This is about 1 in 5 cases and is a non-invasive type. Something I would like to share, the question at the very beginning, do you know somebody, have a family member? My mother is a 2-time breast cancer survivor. And what is very interesting is she had both DCIS the first time, and then the second time she had invasive ductal carcinoma, which is the most common type of breast cancer. This makes up about 80% of our cases. And this is when the cancer begins within the milk duct and then it invades the surrounding tissue. And the last one we're going to talk about is invasive lobular carcinoma. This makes up 1 in 10 invasive breast cancer cases. It begins in the lobules, which is that gland that we saw at the beginning that produces the milk, and then it invades the surrounding tissue. Becomes a little bit more aggressive at this point. Always talk about risk factors. Really, in any type of chronic condition, any type of disease or cancers, there's going to be risk factors that we cannot control. Then there's also going to be risk factors that you can control. So we're going to start by talking about risk factors that we can't control, and then later on in the presentation, we'll kind of talk about what can we do. So some of them include being a woman. 99% of breast cancer cases are in females. We know that because we learned that 1% or less can occur in male. We also saw in the statistic that 91% of breast cancer cases are in women age 45 and older. So getting older is unfortunately a risk factor that we cannot control. Your risk of breast cancer increases as you age, especially after the age of 50. There are genetic mutations. So these are inherited changes to certain genes that increase the risk of cancers. Most prevalent that we know of or hear of is breast and ovarian. If you have close relatives, they can do genetic testing to determine if they are a carrier, and then if you also have it. Reproductive history. So if you start your menstruation prior to the age of 12, and or if you start menopause after the age of 55, Those can be risk factors. Obviously, a family history of breast or ovarian cancer. So just by having it in your family, depending on if it's a first degree, a second degree, meaning is it your mom, your sister, is it an aunt, a cousin, will increase your likelihood of breast cancer. Now, some women who have no risk factors that we just talked about can get breast cancer. And on the flip side, having a risk factor also does not mean you will get the disease. So not all risk factors have the same effect, and it really kind of just depends on each unique person. On the next slide, I think it's really important that we just take a moment to look at the different symptoms. So we learned this long ago, probably in middle school or high school, the importance of doing breast self-exams. And we'll talk about that as one of the types of breast cancer screenings. But knowing your breast is best. These are all little signs and symptoms that something can be occurring. So every day when you get out of the shower, doing a quick visual check is very key. That way, if there's any changes, you're going to notice them much quicker. So if you see or feel a new lump or mass, if you have any swelling of any part of the breast, even if there's not a lump that is felt, just swelling. If there's any dimpling, they give the example of looking like an orange peel. If there's any retraction of the nipple, or if the nipple or the breast skin is dry or red or flaking. If you have any discharge from the nipple, this is other than women who are nursing or producing milk. And then if you feel or see any lymph nodes under the arms or near the collarbone. So it's important to know your breast. That way, as soon as something changes, you can very quickly get it seen. And we'll discuss more about the screenings. I do want to also say that after this presentation, you will get the presentation, you will get the link to the recording, so you can refer back to it, but you can also share it with friends and family and really spread the message of the importance of breast cancer awareness. So on to the types of breast cancer screenings. Another quick poll. What is the 5-year survival rate for localized breast cancer? And again, localized meaning the cancer is confined to the part of the breasts, the lobules, the ducts, what it may be. And what is the 5-year rate? Got all kinds of questions and answers. We'll give it a treated. Yes. Well, if it is treated, that's a great question, Matthew. 5-year survival rate for localized breast cancer that has been treated. All right. We've kind of got a mixture. We're pretty much around 75, 82 to 99%. So let's go to the next slide. This is where I feel like we can all take a deep breath. The 5-year survival rate for cancer diagnosed at the localized state is 99%. That is a really good odds. 66% of all breast cancers that are diagnosed at a localized stage. This is, again, when the cancer has not spread out of the breast. I know, I think more than, or like most people, that it is anxiety ridden, thinking about getting these tests and knowing that, it could be a possibility. But when I hear that the survival rate is literally almost 100% if caught early, that motivates me so much from within to continue to get my screenings on time. So hopefully that gives you some assurance as well. There's many different types of screening tests that can help detect the breast cancer. We're going to talk about them. Obviously, breast exam, whether it's self or with a clinician, mammograms, ultrasounds, and that one, some type of mammogram, additional mammogram, and biopsy. So let's talk about clinical exams. So a clinical breast exam is when you go to a healthcare professional who is trained to recognize any different types of warning signs of breast cancer. So a lot of the times that is your primary care provider, that is your gynecologist. Visually, they are going to ask you to undress from the waist up. They will ask you to do some movements to raise your arms in different areas, and they will look at the shape, the size, and inspect. They will also do a manual check. So they are going to feel around the breast and check for any type of unusual textures or lumps. We are going to talk about breast density, which does come into play, but they should be able to identify if there's anything that feels off, and then they have the ability to do an assessment of any type of suspicious area. So breast self-exams is one we can do at home. So when you do the clinical breast exams, anytime you're going to your PCP or the gynecologist, you can ask them. Hopefully they're doing it anyways, but if not, ask them. It will make you feel better. And something that I personally do is I try to schedule my annual with my primary care provider, and then schedule my gynecologist 6 months apart, so that at least twice a year I am getting a clinical breast exam. In the meantime, what we all should be doing is breast self-exams. So 40% of breast cancer cases are diagnosed because women are detecting them through breast self-exams. They feel a lump. We want all women and men to know how their breast normally looks, how it feels, especially during different times of the month. So you can feel soreness at different times of the month. You can feel more density different times of the month, but knowing that will help you better detect earlier. You are going to reach out to your provider in any instance where you feel something that is off. But for anyone who may not know exactly what to do, it is it's pretty easy. So with the breast self-exam, you are going to remove your top, and you're going to stand in front of the mirror. You are going to mimic some of the things that your clinician would do. So you are going to raise your arms and look at appearance. You're going to look for dimples, redness, puckering, anything such as that. And then it is recommended that you use 3 or 4 fingers of your left hand to explore the right breast. You want to begin at the outer edges, and then you want to move your fingers small circular motions or up and down around the breast to feel for any changes. Then obviously you are going to repeat with the other hand. Something that I was told a long time ago is that you can also kind of keep a breast self-exam diary where you draw 2 circles, and if there's anything that feels off to you, you can mark it where it would be on your breast, and that's something that you can take to your doctor and to show them. But you want to listen to your body. For women, if you are menstruating, you should do a breast self-exam a few days post your period. And then for anyone who is postmenopausal, it can be done anytime throughout the month. However, we suggest doing like the same day. So the 1st of the month or the 15th of the month. And remember, 99% of all breast cancer cases caught early, you have a 99% chance of survival. So wanted to ask you guys, have you ever performed a breast self-exam? All right. It looks like we have a good amount of people that are doing it regularly or doing it, they're at least doing it. So hopefully you got a little motivation and encouragement to start implementing them. If you're kind of anxious of how do I start or what do I do, your doctor can show you what to do. You can also do it along with them. That way, if you feel something, they can tell you this is normal. And you don't, going forward that that's not a problem area. All right, so next we're going to talk about mammograms, which is another type of screening. Would love to know who has gotten mammograms, but that's not a poll question. I hear a lot about mammograms, and I want to educate and hopefully relieve any fear or anxiety around getting one. So mammograms are the best way to find breast cancer for most women of screening age. It is a high quality picture where your breast is flattened or compressed. You can see the picture. This is what the machine will look like. So the plastic upper plate is lowered to come down and to compress on the breast. It is very quick. It is 10 to 15 seconds. And that is just long enough for the radiologist or the tech to get behind, the safe screen and click the picture, and then they walk right back out and they open the machine back up, and then they always change position. So is taken, and this is actually a really good thing because they're taking more views of the breast to be able to identify anything. So if you've never had a mammogram before, do not worry. We're going to talk about what to expect, but just remember it is an x-ray of the breast. It can find early detection before anything can even be felt. So that's another thing. It's great and it's necessary that we do our breast self-exams every month, but it's also necessary that when we are told to start getting screened, we are doing that because we have tools and equipment and technology that allows us to find things before they can be felt. Quick question for you. According to the updated 2024 guidelines, at what age should women of average risk begin mammograms? You guys are such a smart bunch today. Yep. So it looks like the majority of us are saying around age 40. And that is correct. This is for women that do not have a personal risk of breast cancer. So in 2024, they updated the mammogram recommendations. The U.S. Preventative Service Task Force recommends women 40 to 74 at average risk get a mammogram every 2 years. So you're starting at 40, but you're going every 2 years. Next slide. All right. So what to expect during a mammogram? It's really nice to know before you go, especially if you have any type of like scan anxiety. Um, Before you go, obviously you schedule your appointment, you make sure to arrive early, give yourself enough time. You do not want to wear any type of deodorant or perfume because that can provide false sightings. So nothing underneath, underarms, no lotion, and no perfume. You will be asked to remove your clothes from the waist up. They will provide a hospital gown, and then any type of jewelry or anything they will ask you to remove. A tech will bring you back to the room and they will help position your breast in between the two plates of the mammogram machine. They make it as comfortable as possible. At least that's how it's been in my experience. They want you to feel comfortable during the process. The purpose of the plate is to press your breast down to spread out the tissue. And this is a really good thing. The fact that we can have such a machine and technology to do this allows a lot more breast cancer to be detected a lot earlier. They take several images, typically from the different angles, and it only lasts a few seconds. Depending on, if it's just a regular screening or if it's a follow-up, it takes 30 minutes or less, and the radiologist will review the images. They will report back to your doctor, your referring doctor, and then you will get your results. Every healthcare facility is different. Sometimes they give them to you day of, sometimes they upload them to your chart if they have a My Chart system, and sometimes they will tell you right then and there. So how do we understand our mammogram results? So if you look at the different pictures, the first one, this breast is almost all fat tissue. The next one contains scattered areas of dense and fibrous tissue. The third one is where most of the breast is made up of fibrous tissue. This will make it difficult to really see small tumors. And then this last one is a very dense breast, also making it very difficult to spot anything really small. So not only will your mammogram do its job of detecting any tumors, but it's also going to provide your breast density. And that is basically a description of how much fibrous and glandular tissue is in the breast as compared to fattier tissue. So the denser your breasts are, the harder it is to see abnormal areas on mammograms. And unfortunately, having dense breasts also raises your risk of getting breast cancer a little bit higher. But that's why we have additional testing. So the other screenings on the next slide, if you have a mammogram and there's any type of suspicion, they can do things like a breast MRI. And this is a typical MRI. It creates a picture of the breast tissue. And this is used to evaluate known breast cancer or screen those at very high risk. I'll use myself for example. Obviously, I have a very high risk of breast cancer due to my mom not only having one, but two different types. I also have the very dense tissue. So my doctor recommends a mammogram, and then 6 months later, an MRI, a mammogram and then an MRI. So if you've never had that conversation with your provider, now is the time to do it. Say I've had aunts or relatives that have had it, and I want to start making sure that I am getting evaluated properly. Sometimes they'll send you just for an MRI. A lot of times they'd use ultrasounds, which if you ever had an ultrasound, it's pretty easy peasy. It uses sound waves to make images of the inside of your breast. And that can be done, maybe if you're at the clinician doing a breast self-exam and they just want to double check an area, they can do an ultrasound to show whether that breast lump is made up of cysts or is it a solid mass. Solid mass are more likely to be cancerous. And then there's the biopsy. So if they identify a suspicious area, they are going to remove tissue from that suspicious area. They will then take those cells and examine them for the presence of breast cancer. And a biopsy is the only diagnostic procedure that can determine if the suspicious area is in fact cancerous or not. I've also been through a biopsy, so I have lots to share. The experience in itself was not as bad as I thought, but I actually preferred it because I had the peace of mind of knowing that it was not cancerous cells during that biopsy. All right, moving along. Breast cancer, prevention and treatment. So earlier on, we talked about what we could not control, right? We talked about the risk factors of being older, being a woman, of having a family history, of menstruation early or late menopause. Unfortunately, those are outside of our control. But there are things that are inside of our control. So there are things that we can do to help prevent, prolong breast cancer. The first being maintaining a healthy weight. It's especially true for after menopause because excessive weight can increase your risk. We want those who are trying to lose weight to focus on gradual, slow, sustainable weight loss by having a healthy diet and being physically active. Now, there are some, challenges, especially after menopause with hormones and things like that. So you're just going to want to talk to your doctor, but small changes over time usually lead to great success. Getting active. So a lot of these risk factors are also risk factors that you can control for other chronic conditions, diseases, and cancers. So this is lifestyle. Be physically active. 150 minutes or more a week. When you break that down, it's about the equivalent of 5 days a week, 30 minutes. It does not all have to be done at once. You can do 10 minutes in the morning, 10 minutes in the evening, and 10 minutes at night. But as long as you're doing 10-minute increments and you're getting 150 minutes or more, you're meeting the recommendation for adequate physical activity. You don't need to be running marathons or swimming oceans. Walks are fantastic. Classes, doing community classes, working in your garden, playing with your grandkids, all of these different things count towards your physical activity. Cutting down on alcohol. So we know that alcohol increases a lot of risks, especially things like liver cancer, but it also increases your risk of breast cancer. So you want to limit to 1 drink per day or cut it out altogether. And then obviously is quitting smoking. So smoking has been linked to many different cancers, including breast cancer. It's one of the best things that you can do to lower your risk and improve your overall health of health and well-being by quitting smoking. There are some prevention measures. So there are hormonal factors. Hormone replacement therapy, HRT, you want to use with caution and you want to make an educated decision with your provider whether it's something that you should use or not. Women who use a combination of hormone replacement therapy for more than 5 years had a higher risk by 24% of developing breast cancer. HRTs are typically prescribed to help manage menopause symptoms for women in that menopause era. Birth control pills, again, it's something you want to discuss the risks with your doctor. Some studies show that there's a slight increase risk using the pill, especially if you're on them for a long period of time or you started them at a very young age. And then breastfeeding. Breastfeeding is actually a positive one. So breastfeeding is linked to lowering breast cancer risk. Women who breastfeed for 12 or more months have a reduced risk, of 4.3% of breastfeeding. Treatment options. So there are typically 5 different treatment options, everything from surgery, radiation, hormone therapy, chemotherapy, and then targeted therapy in a combination of some or all. For today's purpose, we're just going to focus on the surgery, the radiation, and the chemotherapy. So breast cancer surgery, there's different types. That's a localized treatment. A lumpectomy is for early stages, and that is if the cancer is contained, the surgeon can go in and perform a lumpectomy and remove it. As long as you have clear margins, then you are okay. There is mastectomy, which is the advanced cancer or elevated risk. This is when they remove all breast tissue. Sometimes nipples, sometimes they are able to leave them. And then another type of surgery that's associated with breast cancer is the reconstruction after having your breast removed. Radiation therapies are used to destroy cancer cells. There's external and internal. External obviously delivers beams from outside of the body, where internal is delivered by radioactive material within or near the tumor. And then I'm pretty sure we're all familiar with chemotherapy. This is drugs that are used to slow or stop cancer growth. So there's ones that you can use before surgery to shrink the tumor, and then there's post-surgery ones that can help kill any remaining cells. But again, this is for you, your doctor, your oncologist, your healthcare team to talk about, discuss, and make a plan. I'm going to speed up just a little bit. So life after breast cancer survivorship. Just because you complete treatment, it doesn't mean that the journey ends. We have more than 4 million survivors and those living with breast cancer in the US. This is more than cancer survivors. Almost any cancer treatments have side effects, so you're going to want to monitor side effects after your journey. Sometimes you're on medications for years or a lifetime. You always want to get your regular medical checkups so that you can be monitored very closely and you can detect reoccurrence as soon as possible. Obviously, survivors should stay in close contact with their healthcare team. A lot of times you are partnered with a nurse navigator or someone that can help you navigate your different appointments, your medications, your treatments, so on. And then you want to know your body and advocate for yourself. We don't want to just think fatigue is normal because, I had cancer or the medicine. If you have side effects, pain, fatigue, chemo brain, lymphedema, depression, even post-traumatic stress, these are conversations you have with your doctor. Your doctor can assess and evaluate if this is if this is from the medicine, if this is not normal and should be looked into, or they can help you get to the right care provider, especially when it comes to depression and post-traumatic stress. Once you've had cancer, I'm sure most of you that have had it can agree that you feel nervous. There's stress and anxiety. Sometimes you're even afraid to have those follow-ups just because you're worried. Those feelings are all completely normal. They've even termed it scan anxiety. Scan anxiety, say that 10 times fast, but there's resources available to help you. Also, you can lean on people, your care team, a friend, family member, a neighbor, whoever has supported you before. There are a lot of breast cancer survivorship groups that you can join because those people have been through it. And then lastly is the reoccurrence. Breast cancer reoccurrence is when it comes back. Anyone who's had breast cancer is at risk for reoccurrence. However, most people that are diagnosed will never have a reoccurrence. It is really rare, especially in my mother's case. Things that you can do are all things that we've already talked about. Eat healthy, be physically active. We want to quit smoking and drinking, just saying it again, or monitor drinking. You want to embrace your support system and then connect. Connecting with other survivors is a great resource. Speaking of resources, the last piece of today is the resources that Care First provides. We, for any Care First medically insured, or depending on your group or your employer, has access to Care First Wellbeing. Care First Wellbeing is the wellness program that can provide you tons of resources that are customized to your interest, your needs, and you as the person. And that all starts by taking the Real Age test. The Real Age Health Assessment is a clinically validated health assessment that guides you through a series of questions to help determine the physical age of your body versus the calendar age. It then unlocks a personalized user experience because it now has data and it knows and understands you and your health. Within the Care First Wellbeing program, there's personalized health timeline feeds, tracking capabilities, monthly challenges for motivation. Everyone has their own health profile. And we also have an unwinding program. This focuses on stress, relaxation, anxiety, feelings of depression. So that can also be a resource that you can tap into as well. Close-Knit is virtual first primary care, but they offer more than just primary care services. They have mental health care services. So if you're feeling like you need someone to talk to, you need medication or therapy, Close-Knit is an excellent resource for you. Again, if you have Care First medical coverage. And last but not least are our Care First core wellbeing programs. So within the Care First wellbeing program, you have that Real Age Health Assessment where you find out how old you are in health years versus biological years. You have your timeline feed, your trackers, all of that. In addition, you have health coaching, which is one-on-one phone coaching telephonically with either a certified health coach or a registered nurse. There's lifestyle management, which anyone qualifies for, and then there's a disease management, which you have to have one of 10 core chronic conditions to enroll. But regardless, this is having a support and accountability partner that helps educate and motivate you to be the best that you can be. We know one risk factor that we can control is our weight. So we have 2 weight management / diabetes prevention programs called Noom and Eat Right Now. You can look into have a smoking cessation. So that's our 21-day program to help our members quit smoking for good. We also have financial well-being, as cancer can cause a strain on finances and stress. And then we offer Blue 365, which is an exclusive health and wellness discount site. It's really very cool. We have negotiated discounts with retailers across the nation for discounts for our members. Things like Fitbit and meal subscriptions, gym memberships, the list goes on and on. And then lastly, just want to remind you that we do have more Care First resources for you. So we have, we post the latest guidelines for preventative screenings and services. There's the health library that you can access and look for all different types of information. And then we do have care management programs for anyone that is facing serious or complex healthcare needs. That is a resource to you. I know I am running out of time. Do we have any questions?
It doesn't look like there's any in the chat, Katie.
Awesome. Well, I want to thank you all for attending. I want all of our survivors that are on